The Mississippi State Department of Health has issued another warning today. Don't take the livestock drug ivermectin to treat COVID-19.
Yeah, they've already gotten reports that 2 people going to the hospital after taking the animal medication. WCBI's Stephen Pimpo talks with a local veterinarian today who says that improperly using the drug is a hazard to people and it can also affect animals. He joins us now live in the studio to explain.
Audrey, Joey, that's right. Dr. Karen Emerson with Emerson Animal Hospital in West Point says they haven't been able to order ivermectin for 2 weeks now because people are improperly using it to treat COVID-19. The end result? More sick pets, more sick livestock, and more sick people.
Not only are you hurting animals getting the medications they need by you buying it and taking it, you're also harming yourself with potentially hazardous effects.
That's what veterinarian Dr. Karen Emerson says people are doing by taking the anti-parasite animal drug ivermectin to treat COVID-19. Something the Mississippi State Health Department and FDA warn against.
Hypotension, the diarrhea, the vomiting, the sudden death, the liver damage. I mean, those are all very critical things that can happen to you.
Mississippi's Poison Control Center says they've been getting increased calls, and about 70% of them have been related to people taking the ivermectin that's meant for livestock. Dr. Emerson says she has just one 15-milliliter bottle left at Emerson Animal Hospital in West Point.
It's a very big necessary drug in veterinary medicine, and unfortunately right now we're unable to get the drug because of all the human consumption of ivermectin.
If the misuse of ivermectin continues, Dr. Emerson says more pets will have to suffer longer.
Some animals are just not going to be treated because there's not a lot of other drugs out there, especially these little bitty hamsters and rats and rabbits and guinea pigs.
And the beef industry could even be affected.
That is what they use to treat internal parasites in cattle. And what do? We eat cattle. We have to keep our cattle healthy. We have to keep the food supply, the chain going. And ivermectin is a drug that we use.
Instead of ivermectin, Dr. Emerson recommends something that is safer and FDA approved.
If you have COVID or you're scared of getting COVID, get vaccinated. It's a lot safer than going and taking an unapproved animal product that we use in veterinary medicine.
There is a version of ivermectin approved for human use to treat intestinal complications, but it must be approved by a doctor. Neither the human version of ivermectin nor the animal dose are approved by the FDA to treat COVID-19.